Sally and George have already made a lasting impact on healthcare in our community.
George and Sally, when I came to Middlesex, were very well known to the Middlesex community, and I think very well known within the community as being philanthropically inclined and interested in helping our organization to serve the health needs of the greater Middlesex community.
Simply put, Middlesex Health is an awesome hospital, an awesome organization. You know, they're great people, good care, very friendly, you know, and it's just a tremendous asset to the community, particularly with the Shoreline Medical Center, which is a wonderful facility, and in a nutshell, why we support Middlesex Health.
The hospital did their part, and we did our part, and it happened, and everybody loves it. They tell us all the time. I have friends that go for an MRI or a mammogram or blood work, and they see our name on the wall, and they say, "We are just so thankful that we have that here."
I was diagnosed in 2019 with breast cancer. I currently come for radiation and oncology. It makes me feel that I have a whole community around me that cares about my well-being, that they want me to be well, because I'm not treated like a number when I come here. Everybody, I feel like every time I walk in, everybody knows your name, which is, for a patient going through what I'm going through, it means a lot. To have people like that in the community that want to give back is such a blessing, and I am so incredibly grateful. I didn't know that there were people like that.
Since Middlesex Health is a community hospital, we're very much concerned about the health needs of our community, and we're constantly looking to identify what those health needs are as health needs evolve. We identified the need for diagnosing autism, treating autism, and other developmental health needs of children. And we approached Sally and George with the idea of creating a center to address those needs.
It's a service that they understand the importance of personally, and again, they were there saying yes.
Definitely have a need here because of our son, who was born 47 years ago, and there was no autism spectrum then. So I struggled for decades trying to find the right programs for him, and he was never really diagnosed and put on the spectrum until a few years ago.
Today is 1 year since we started services, and we've been coming here every single day. Monday through Friday we do the ABA services, and we've been doing the physical therapy and the speech. Before, you could just see she was just so frustrated, there was just all this kind of anger. You could tell like there's stuff she wanted to communicate and to get out, but she couldn't figure out how to do it. And coming here and just everything we've been doing, overall, she's so much more relaxed, so much more happy. She just comes in and out of here just smiling and giggling, and it was not the girl that I brought here a year ago. Like, I know she's getting help, she's being taken care of, and she's happy, which definitely makes it so much better.
What we do in speech therapy for that population is implement what's called augmentative alternative communication. So as you can see, all the words are over here. Our first page you'll see is all our really high frequency words, like the word want, for example.
I want more. I want more.
So our son was actually one of the first patients here. We started coming in November of 2022, I believe. We started off with OT, PT, and speech, and then from there transitioned into ABA therapy. So my son was diagnosed at 2 with autism, and he was diagnosed at a severe support level. So he is nonverbal. He wouldn't look at us, he wouldn't respond to us. You know, we couldn't communicate with him at all. So through all the services, and especially ABA, and Ashley was our original speech therapist, and she helped us get set up with a talking device, and that made a huge difference. It calmed his anger down because he has a way to communicate with us now. Sorry, I get emotional. It gives him a way to communicate with us and for him to voice how he's feeling. And just through all the therapies collectively, he's been able to, even though he can't use his words, tell us what he wants and what he needs, which has been life-changing for all of us. And he's just so much happier now. It's like a weight off of his shoulders.
When we started working with him, he, just kind of hummed. And then about a week later, I went to the house and she was like, I have to tell you all the things he said this weekend. And, I hadn't heard him say anything at all at that point. And she was like, I swear he said kitty, and he was saying mama.
So my heart goes out to these young families that are going to the Meyer Center, because if I had had that, it probably wouldn't have been as devastating as it was at the time.
I am so delighted that Sally and George were chosen to receive the Distinguished Service to Philanthropy Award this year.
Thanks to the generosity and the commitment of Sally and George, we've been able to provide for healthcare services on the shoreline in a way that we never would have been able to do.
I know a lot of people here because I grew up here, so I have a lot of contacts, and I'm kind of used to asking people for money, so when they see me, and then when they see him, it was like, and he could ask for the money. That was refreshing.
I don't know anybody that can say no to Sally, including me.
My kids.
One of the things that strikes me about George and Sally is just how humble they are, and how committed they are to helping serve the community. And that's not something you see every day. It's very special.
It's very gratifying. It's just, it makes George and Sally feel really good that, we have the resources to help other people that, need the help.
To come here and be part of the community and be accepted and loved and taken care of, that's a gift that you can't put a price tag on. So thank you wouldn't cover it.